factor that we need to discuss here is the second stage of labor. That is when you're fully dilated and ready to push the baby out. Are all women strong enough, or are there any indications wherein we need to cut short this particular second stage of labor?
With second stage of labor in a first pregnancy, we say we can wait up to 2 hours, and if the patient is on epidural, we can wait up to 3 hours. But if it's a second pregnancy, we generally wait for an hour. Yes, if you are on epidural, we can wait up to 2 hours. And in certain conditions, we may have to cut short this waiting period of 3 hours or 2 hours. Yes, if you waited for 3 hours in primary and 2 hours in multi, then we again discuss with the patient about the options of what is called as vacuum delivery or forceps delivery. In a vacuum delivery, we apply a small plastic cup on the baby's head, increase the pressure, and with the contraction, pull the baby out. Probably you would have all seen in that one of the famous movies of Three Idiots, where Amir Khan and his friends do the delivery, but it's not that easy. So we do discuss the option of this because it can also lead to certain complication. The next option is what's called as forceps delivery. In the forceps delivery, there are special instruments which is put around the baby's head, and it is pulled out with the contraction of the uterine contractions. Now that also requires lots of expertise. So any obstetrician who is trained well with these instruments can handle a second stage delivery. In certain conditions, we may have to cut the second stage a little bit shorter. Like if the patient has a pre-existing medical condition like heart disease, if she has rheumatic heart disease, or she is asthmatic and not able to completely bear down properly, and certain cardiovascular complications also, where we have to cut the second stage a little bit shorter. If we notice persistent fetal heart deceleration, considering we don't have certain monitors here which is called a scalp blood pH in most of the centers in India, we would have to resort to our clinical skills and acumen, where we see that if there is a persistent deceleration of the fetal heart, we may have to cut short the second stage of labor either with the vacuum or the forceps. Next is, as we are already discussed, meconium stain like. If we know that the baby had a meconium stain like, if the baby has a deceleration or fetal distress, the more likely that it may aspirate the fluid. So in that case also, we cut short the second stage of labor.
Another point to highlight here is having these instrumental deliveries in a multidisciplinary setup, because sometimes, or half of the times when we apply a forceps, sometimes we can have vaginal tears, we can have excessive bleeding in the form of postpartum hemorrhage. These need again a teamwork. A team of consultants can handle a post-delivery complication in a much better way. Another point to highlight here is that any low-risk case can become complicated during the time of labor or after delivery. Particularly, we have seen a lot of hemorrhage or bleeding following delivery. This kind of situation needs to be handled in a multidisciplinary setup where you have 24 hours availability of anesthetists, intensivists, radiologists, and good, well-trained labor room staff, where everything is made available immediately and the complication is handled immediately.
To have a good outcome of pregnancy and to have a very happy family at the end, we as a hospital have ensured to have a good multidisciplinary team, and we practice as a team so that you are never left uncared. So choose Aster RV, JP Nagar, for your pleasant journey in the pregnancy.